Hi, my name's Randall. I work at Campbelltown Hospital. I am a grade 2 cleaner / back dock worker. I moved here in 2010 from Moree. My tribal is Kamilaroi, and I used to do other jobs before I started working here. Before I started working here at Campbelltown Hospital, I used to work at a Wangaraundara Mac Centre as a preschool assistant, teacher's aide, and that's at Thurrowa Aboriginal Corporation. And then I got to end up working here after. I've been working here now at Campbelltown Hospital since 2010. That's approximately about eight and a half years I've been here now. I heard about the job when I was coming up here to have lunch with the missus, and I was walking out and one of the ladies stopped me and asked me, was I Aboriginal? Was I looking for work? And I said, yeah, what kind of work? And she goes, you can put your name down for many of jobs or traineeships. So I applied for one and I was successful at getting it. I choose to work at Campbelltown Hospital. I reckon it would be a great move for my career and a great opportunity to meet other indigenous people in our community and work alongside of them and see them as they come into the doors as patients. My journey at Campbelltown Hospital has been some highs, some lows, a little bit in between. You get some good days, you get some bad days, but you hold yourself together and do your task for that day. Working here at Campbelltown Hospital has been a great time I've been here, but financially it's helped me a lot. It's given me a lot of stable work. I come to work every day, go home. It's just a great thing knowing that I've got full-time employment to come to each day, and I've got such great things I can support my kids and that with now, and my grandkids. I don't need to stay in the job I am. I could actually move up the ladder into management roles, because I do rubbish, waste and all that, linen. I could actually branch out into different areas into the hospital. There's many roles that everyone can do here. My role here at Campbelltown Hospital is I used to do the clinical bins. I come in at 5 and I'll walk around the hospital all day, pretty much collecting and checking the clinical bins. But I got moved off there and now I do soil linen, and it's pretty much the same thing. I walk towards picking up the bags, and then when I do 2 rounds of that, I go and pick up the needle casings. We call them the sharps, and we go check every ward of that. So we do 2 rounds of that and 3 rounds of picking up the linen bags. We've got a great team on the dock. There's about 5 or 6 of us, and we all let each other know that where to go and what needs to be picked up. If they can't do it there and then, we'll jump in and go and help each other. So it's a pretty good situation out there what we got going. I enjoy my job here at the hospital because I get to meet great people, not only just other workers from other departments. I get to meet great community people and see everyone who walks in and out the door. I got a lot of moments that I'm really proud of here. The most one is happened recently when they approached me to buy some shirts off me so the staff can wear them around the hospital at NAIDOC Week, and that's been really good because it would be great to see them represent our culture as well as theirs. The way I help the community when they come up here is when our liaison officer's not around and they see another Indigenous worker, they ask them, where can we go and have a cup of tea? Where can we go and have a quiet space? So we direct them to our Aboriginal room called Uncle Ivan Lounge. They can sit down there and have a cup of tea, have a yarn, and just as one mob. In my job, the way I develop stronger relationships in the community is when people come in and they desperately need something and they need help. They could walk in the door and they're not getting the right directions or right way, and they see another Indigenous worker and we can point them in the right direction. If we can, help them. But if we can't, we'll point them in the right way where they can go and get the help they need. During my time here now, working here, I had a lot of support through other Indigenous workers in my position. They taught me a lot of things, how to go about it the right way. I've been supported by an old network of stuff what happens throughout the hospital, so I'm really glad there is a great thing here. So it's making me want to come to work every day, to have this support and stability in my job. When I meet people around it, they say, "How do you get your job?" And I tell them how I got my job, and they tell me about their job. How can they change and get a job here? And I say, look, there's great benefits here. You can start at cleaning and work your way through and go to management. You might even end up at level 1, one of the big managers, and start running the place. If you come in and work, there's endless possibilities what you can get through. My role here at the hospital takes a great personality, and you got to have a great sense of humour. You might run into someone who's lost, so you got to have a good direction around the place. Not only that, you got to put on a smile, even though you don't like the job, what you're doing, but it's a job. Be thankful you got one, and be thankful that you know what you're doing and how you know your way around the hospital, and you can help other people find their way. To get more staff at Campbelltown Hospital would be great. It would be a great asset, not only for the hospital, it would be a great asset for us, because we can teach them and show them the way around the place and help them. But there's people who come before me and has gone. We want to fill them voids and be thankful that the hospital has given Indigenous workers such time and a job, the place they come to. Having more Aboriginal staff here means that when community come up at sorry time, we can actually help them a lot more and understand what they're going through. It'd be great if we even had more staff here to help people like that. At Campbelltown Hospital, we need to increase our staff around here as Indigenous, because when other people come into the hospital and they don't see an Indigenous face, they get a bit worried and won't want to talk to anyone, or they get shame and just want to walk away, and then they don't get the help that they require. If you was looking for a career, I would suggest come and work at the hospital or work in one of their outreach places, because there's a lot of opportunities for everyone. But Indigenous, there's going to be a lot more around here. You just got to hang in there and just keep applying for jobs. My time here at Campbelltown Hospital, I've had a great time. I've met so many people, not Indigenous, all different nationalities. I've tasted all their food, been invited to their places and that. I've had so much fun working here, and now I think it's time for me just to keep going and retire here, because it's a stable job, and I suggest for any Indigenous person who wants to come and work here, just come in here and be yourself.